On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the division's preliminary rate decision for Regence Blue Cross Blue Shield of Oregon's 2024 second quarter small group rate filing. The division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. While reviewing a rate request, division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is, how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Division actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review full rate requests on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. Our agenda for today will be representatives from Regence making a presentation and describing their rate requests. Then division staff will lead a discussion about the division's preliminary decision. And finally, we will accept public testimony. If you'd like to make a comment on a company's filing, please unmute, introduce yourself, and make your comment. The online public comment period closed on December 15th. The division will make a final decision about these rate filings shortly after this hearing. Regents, please begin by introducing yourselves and explaining your rate requests.
Great, thanks. I'll also share my screen while we're at it. I'm Lisa Mudgett. I am the certifying actuary for the small group filing that we're requesting today. Oops, sorry, wrong share. I'm joined today by Janessa Sanchez and Chris Jasperson. We are all fellows of the Society of Actuaries and members of the American Academy of Actuaries, in good standing and able to do this filing. Sorry, the share thing is. All right, there we go. In general, this presentation is very similar to what was presented at the August rate hearing in preparation for our Q1 approval. So we still have a long history of serving Oregon, so we'll just skip through that. In general, the big picture is the same for our Q2 rate filing as it was for Q1. We are requesting a 7.7% annual rate change starting for Q2 for groups renewing in Q2, Q3, and Q4. The growing cost of medical care, and specifically for this filing, the increase to GLP-1 drug costs is the main driver of this refiling. So there are no other plan changes that we've made since our Q1 filing. So the product portfolio, our benefits, the networks, the areas, all of that remains the same. We really are just amending our drug trend, which then reflects the overall medical cost trend that has increased quite considerably this year. So I'm not really sure, since nothing else has really changed
Sure.
at this point, are there questions that you have for us?
Yeah, thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Thank you, Ethan. And thank you, everybody who's joining us today and listening in on the web after this hearing is posted. This is a second quarter filing for Regence, and I wanted to talk a little bit before I get started what that means to anyone listening in. If you are in a small group that renews in January of 2024, this filing will not apply to you. This is for renewals for groups that renew in April through November of 2024. However, if you are listening in to these changes and you do renew in January, there is some information that you can get on what to expect potentially for 2025. So you're welcome to go ahead and listen in. However, if you want to know what happened in the January 2024 filing, you will need to visit the prior filing that was submitted in May. Okay, so this is an update to existing rates, meaning this second quarter filing is a modification to already approved rates out there. There are first quarter, second quarter, third quarter, and fourth quarter rates that were approved by the division in July and August for all of these plans, and all the requests made are a revision to that existing rate. So when we look at this rate and we look at this filing, we look at the differences. What's changed? What's the reasoning behind those changes? And what's the overall dollar amount? As I said, this affects later groups in the year. So the main difference and the predominant change in this filing is that the experience has been updated and all of the factors that are affected by experience have had minor adjustments to them. And that accounts for the entire difference. I did want to ask the company a question. You stated in your exhibit a 7.7% average annual increase. However, I pulled from the filing, and I will pull it up now on my screen, that their request said 8.2 average rate impact. Could you talk about the difference between your 7.7 on the exhibit and the 8.2, which is on the general information tab of the rate filing?
Yeah, I believe that 8.2 refers to this Q2 rate over the Q1 rate of the prior year. And so that is the difference there. So if you look Q2 over Q2, we originally filed a 6% quarter, year over year change, and this was a 1.7% additional request.
All right, so we will look at the changes from the existing rates that shouldn't affect the actual rates requested, but I do believe this 8.2% is not what it should represent, which is the second quarter over second quarter, actually a weighted average of all 4 quarters. Or at least the 3 quarters that are renewing versus their respective quarters. So we have this, what we're talking about for anyone listening in, there are a time adjustment to the rates. And prior to the this filing, there was a 1.9% adjustment to each of the second, third, and fourth quarters. So rates filed later in the year would be slightly higher. This is consistent with how group business is priced in general, to encourage companies to get in and renew and not push back their renewal dates. And the change here is, yes, go ahead.
I have one thing to add. Sorry, Michael. On the difference between the 7.7 and the 8.2, 7.7 is the percentage just for those renewing in Q2, and 8.2 is the average for Q2, Q3, and Q4.
Okay, then the 8.2%
Thanks, Janessa.
is the correct.
Yeah, you bet. I just pulled that up to look.
All right. So since this third and fourth quarter members and groups are looking at this filing as well, we're going to look at the 8.2 number, not the 7.7. So I appreciate you clarifying that. In which case, I believe that the 8.2 number is correct. It does reflect this filing. And the first quarter filing, as a reminder, was for 6%. So we're talking about a difference between the previously approved rates, average increase over all quarters, and the second through fourth quarter increase at an 8.2, a difference of 2.2%. And that is done in a couple places. First, there is an adjustment to the previously approved rates of 3.6% for second quarter, but over the 1.9% that they would have gotten for this time adjustment, it's actually only a 1.7% increase, and I think that's the 7.7 you're talking about. Then the adjustment to that time adjustment has gone from a 1.9% to a 2.1%. So for third and fourth quarter, third will be 2.1% over second quarter. Fourth quarter will be 2.1% over fourth quarter. There's a lot of moving pieces, but that's in place of the 1.9%. That's not in addition to. So with all that considered, the average increase for everybody is an 8.2% on this filing. The reason is because of, as we said, the change in the base period experience, which accounts for most of the change, and then this weight loss use for the diabetic drug, as explained by the carrier in the filing as the Y. So they're seeing an increased utilization because of this drug. They've made estimates of trends going into 2024 and 2025 of 9%, which is higher than the rates that they're using to price this rate filing. They're only using, I believe, 8.7% trend going into this filing. So this is something, if you are paying attention for 2025, this is something that they have hinted at going forward. We may see prices continue to rise. This is a popular medication out there, and there has been high demand for it. We have heard this from other carriers. However, the impact to the existing rates, 1.7% to 2.2% overall, has been relatively minor. And because we see nothing that suggests that this is not happening, we are preliminarily approving this rate as filed. Thank you. It's long way around. We are going to approve this rate as filed.
Thank you.
Regence, do you have any additional information or comments you'd like to make at this time?
No, thank you very much.
Great, thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, doesn't look like anyone has signed up to testify. Thank you, and that concludes today's hearing.
Thank you. Happy holidays.
Thank you.
Thank you.
Bye.
Bye.
Thanks, everybody.